Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very important topic, the peripheral and spinal cord sensory syndromes. The peripheral and spinal cord sensory syndromes, part 8 of concepts of sensory system. Polyneuropathy. Symmetrical distal sensory loss. Sensory loss may affect one modality preferentially. That is, if small fibers are affected, pain and temperature is lost. If large fibers is affected, position joint vibration sense, reflexes and motor system is affected. They can have areflexia or hyporeflexia, weakness if present, relatively symmetrical. So in polyneuropathy, symmetrical distal sensory loss. Sensory loss may affect one modality preferentially, depends on whether it's a small fiber neuropathy or a large fiber neuropathy, areflexia or hyporeflexia, weakness if present, relatively symmetrical. Polyradiculopathy, asymmetric sensory and motor loss, proximal and distal part of the limb differentially affected, reflex loss limited to region of affected roots. Ganglionopathy implicates all sensory modalities, proximal body parts are affected, but ataxia, that is the sensory type, is often prominent and usually seen in paraneoplastic disorders. Diabetic syndrome, prominent loss of vibration and position sense in the feet with sensory ataxia, Romberg's sign, secondary Charcot joint deformities, areflexia and root disease, but preserved reflexes if posterior column disease. Myelopathy, complete transverse lesion, loss of all sensory modalities below level of lesion. Syringomyelia, loss of pain and thermal sense with preservation of touch and joint position vibration sense over restricted region of the neck, cape, arms and hands. Anterior spinal artery syndrome, loss of pain sense with preservation of vibration and joint position sense below the level of lesion, because the posterior column is supplied by posterior spinal artery and therefore it is paired in anterior spinal artery syndrome. Whereas if it is a posterior spinal artery, posterior column gets affected. Posterior column gets affected. So posterior column same as diabetic but reflexes preserved. Hemichord, Brown-Sequard syndrome, loss of pain sense opposite to the lesion and beginning several levels below it, loss of vibration and joint sense and power on the side of the lesion and below it. So hemichord means one side of the cord is affected, spinothalamic crosses over, so pain and temperature is affected on the opposite side, posterior column manifestations and pyramidal tract manifestations are on the same side, so joint and position sense and power are affected on the same side. So these are all the important concepts of the syndromes. The other important concepts I put in a book called Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas. This book contains all the essential information pertaining to clinical neurology and therefore it will be very useful for students appearing for clinical neurology exams. The other book I have written is Focused Neurology, written by me, Dr. Sreenivas. This book contains all the concepts of neurology in a question and answer format, and this book will be very useful for students appearing for orals and viva. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts on syndromes. If you have enjoyed it, please like and share the link. But please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.